We're joined now by Professor Brian Aller, the President of the Australian Medical Association. Good morning.
Good morning.
Now, the government's GP co-payment, they don't seem to have abandoned the policy. It seems to be on the back burner, won't be introduced back into the Senate this year. Is that a good thing or a bad thing or an indifferent thing?
I think it's bad to have uncertainty. I mean, this proposal is a bad policy. It's not just unpopular, it's just bad policy. And to have it sitting there in the background really stops what discussions we need to have. We need to actually start talking about health policy, not just dollar amounts, but actually health policy, how you actually make a healthcare system sustainable and build on the foundations of our healthcare system so that we can do things like prevention of chronic disease, management of chronic disease, and make sure that we actually invest in general practice and primary health care to keep people out of expensive hospital care in the future. That's the important discussion that we need to have, and having that co-payment over the past 6 months has really meant that none of those discussions, none of those true complex and nuanced policy debates have actually occurred.
Now, the government's objective, I guess, is to address rising costs in the health system, everything from the ageing population to new and expensive drugs and medical technology. You'd support that, at least the need to bring costs under control?
Well, actually, when you look at the rising costs in healthcare, they actually are sustainable. I mean, the narrative that was built up before the last budget about Medicare being out of control, being unsustainable, and even today the Health Minister saying it's dead unless we can actually do something about it. Look, if you look at the raw numbers over the last decade, yes, there has been a substantial increase. But actually when you look at that year on year, the rises have actually been quite sustainable. It's in line with other OECD countries. Our expenditure as a proportion of GDP has remained relatively stable. It's clicked up a fraction, but still remains within the OECD average, and we get very good results for the amounts that we spend. At the end of the day, we need to decide what we want. To have people live longer, to have better treatments, to manage people through older age, we do need to spend more on healthcare. Now, doctors and nurses and everyone in the healthcare system have been looking at efficiencies for years. So to suggest that somehow we're not doing that is completely false.
So if the system as it is and as it is evolving is sustainable, why was the AMA proposing its own $6.15 GP earlier this year?
Well, because the answer is actually looking at general practice and primary care. That has been an area that has been lacked investment. It's where if we really want to look at sustainability, managing that older population that often have 4 or 5 chronic diseases, managing those people and keeping them out of more expensive hospital care is the answer. So the AMA's alternative proposal had protection for vulnerable patients. So the government essentially paid the co-payment for those that were under 16 or on concessions. Those that could afford to pay, that weren't on concessions, had a modest co-payment without a cut to the Medicare rebate. So this was about actually getting money into general practice to encourage the sort of quality general practice that does the chronic disease management, the prevention, that encourages people to spend more time with their GPs, because that is the area that we need to invest in for the future.
Now, if the government isn't able to get this GP co-payment through its current policy through the Senate, which now seems clear, are you concerned that they're going to try and take some backdoor method, cutting back on bulk billing incentives or imposing co-payments through regulation? What would your concerns be there?
Well, look, I think that would be a very cynical approach, and that approach just really ignores all of the issues around the policy and why it's not supported in the first place, both inside the Senate but also in the community. And so I think that would be a poor political but also practical approach for the government to take. There are issues with that, taking that approach. They can't introduce a co-payment unless they have legislation. They can't change the rebate, which is a percentage of the fee, without legislation. What they can do is actually change the fee. But that is a disallowable instrument in the Parliament, so the Senate would be able to actually vote that down and stop that from actually going ahead. So I still think even if they try some other backdoor method of getting this sort of proposal through, which would essentially just translate to a cut to the fee, then I think that would be a very poor approach, and I think it would be hopefully unlikely to be supported by the Senate.
What observation would you make about the level of consultation the government's gone through in trying to rein in health costs?
I think it's been very poor, and I've got to say it's been one of the most disappointing things. So before the co-payment was announced, there'd been essentially no consultation. We had the Commission of Audit, we'd had an announcement last Christmas of maybe a $6 co-payment for general practice, no discussion of pathology and diagnostic imaging, and everyone believed it would be protection for vulnerable patients. But of course, the proposal that was announced in the budget was completely different. No one had actually seen that proposal. Certainly no one in the healthcare sector had seen it. And it's one of the reasons why there is absolutely no support for this proposal. No one in any healthcare group, let alone the AMA, supports the proposal that the government has put through. And since that time, because no one has actually supported that proposal, the government's been very unwilling to actually have any policy discussions around health. I mean, health is a bit of a vacuum when it comes to policy discussions. If you take out GP co-payment proposal or the co-payment proposal, really there have been very few discussions around actual health policy. Health policy is much more complex than a $7 co-payment. You actually need to have a discussion about more complex funding models and about how you actually make sure that you meet the challenges that are clearly there in the Australian healthcare system.
So why isn't the government consulting with the AMA?
Well, it's really either you support the government's proposals as they put them, or you don't. And there doesn't seem to be a middle ground. I mean, remember the AMA were asked by the Prime Minister to come up with an alternative, and I felt that that was a positive move. We achieved the idea of, in their words, a price signal. We actually addressed many of the issues that they wanted to address, but we didn't actually have the savings of $3.5 billion over 4 years. And because our model didn't have the savings, it wasn't even entertained by the government. The Health Minister, even weeks after he'd had the proposal and we started to announce it, during the announcement got up and described it as a cash grab for doctors. Now, I thought that was a very poor approach on behalf of the government, having asked us to come up with an alternative. We negotiated in good faith to come up with what we thought was a very good proposal, a middle ground response, and yet they declined to even engage on that process. And so there's been little engagement since. And of course all of this has been wrapped up with the Medical Research Fund, which is also a very cynical move on the government.
Okay, you know this field better than just about anyone else. This latest announcement, or kind of non-announcement, the governor sticking with its policy, simply not pushing ahead with it through the Senate. Where do you see this going over the Christmas period and into next year as we head towards another budget?
Well, the question I have is who is in charge of healthcare policy? Because we have the Prime Minister briefing journalists in the background. We have the Health Minister saying the same old lines that he's been saying since May. They haven't changed in any way. None of those assertions that he makes about sustainability are actually supported by the evidence, including, got to say, the last AIHW report, which actually shows that healthcare expenditure in real terms went down. So, unless we actually start to change the debate, take the co-payment proposal off the table, re-engage in actually a debate about health policy, having that complex discussion about nuanced policy that actually addresses the concerns that doctors have and patients have, then I'm afraid that we're not moving ahead.
It's likely there will be a ministerial and a cabinet reshuffle sometime in coming months. Would you like to see a new health minister?
Well, the issues about who's going to be in that ministry will obviously be up to the Prime Minister. But what I would like to see is the Health Minister engaging in health policy rather than sticking to the same old lines. I mean, the AMA and all the other health groups are more than willing to engage in health policy. There are lots of ideas out there, and I think it's a shame that many of those ideas and those policies and things that people really want to discuss people have not had the opportunity to do that, because I think it's a shame for this government that they can't actually move ahead with building on health. We actually have an extremely good health system in this country. I think our foundations and the health system we have is something that, as President of the AMA, I'm certainly very proud of, and something I want to guard and protect. I think we have a lot of ability to build on that healthcare system and make further improvements. And I know that the AMA has ideas. I know that many other colleges and other groups have ideas. And what we need to do is harness all of that intellect and energy that's out there to actually come up with some decent health policy that actually is going to move the debate forward.
Okay, Professor Brian L., thanks for your time
Pleasure.
today.